disinfection programs. And as you know, cleaning and disinfection of the physical environment in congregate living settings, including long-term care homes and retirement homes, is important. It helps to reduce the number of microorganisms that may potentially be transmitted to other individuals. Today's webinar is targeted to those individuals who are responsible for or take part in or complete environmental cleaning and disinfection within your setting. Just a few housekeeping pieces before we all get started. If you can please ensure that your mic is on mute unless you are asking a question or sharing a comment with the group. You can also pose your questions and comments in the chat box. This box is being monitored by our IPAC Hub team throughout the webinar, so we will do our best to answer all of your questions throughout the session. At the end of the session, we will have a poll question with an opportunity for you to share topic ideas with us for future IPAC Hub webinars and communities of practice. So please give that some thought throughout the session today, and we look forward to your input at the end of the session. The slide deck, tools, and resources shared in today's session will be sent to all participants following today's session. We will begin this morning with a land acknowledgement, and it gives me great pleasure to introduce to you Rodora Lalo, who is an IPAC specialist with Public Health Ontario, who has kindly volunteered to deliver today's land acknowledgement. Rodora, over to you to get us started.
Thank you, Michelle, and good morning, everyone. I'm going to give you the land acknowledgement for today. I acknowledge that I live and work on the traditional lands of the Anishinaabe, Haudenosaunee, Lenape-Pewak, and Atawandra nations, on the lands connected with London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampun. I respect the long-standing relationships that the Indigenous nations have as caretakers and stewards of the land and significant contributions to the society. So for this morning, we are going to go over the role of Public Health Ontario compared to other institutions in providing IPAC expertise in Ontario, provide an overview of the IPAC resources that is related to environmental services, environmental cleaning and disinfection, as well as selecting the right and proper cleaning and disinfection products, work through a virtual activity to review how to read the products correctly, and go over the program overview from start and actions to take within your environmental cleaning program, share tools and resources, and how to identify where IPAC hubs can provide support to your setting. Before we move to the environmental cleaning presentation, I just want to highlight some of the Public Health Ontario resources that you can access with regards to environmental cleaning as well as infection prevention control resources. So Public Health Ontario provides scientific and technical advice to our care partners, to our healthcare system, such as our public health units, hospitals, long-term care facilities on IPAC issues. Public Health Ontario also developed evidence-based informed resources and approaches to inform the support provided to IPAC hubs. We also provide laboratory testing and support and work with ministries and other governments on a coordinated approach to strengthen the IPAC program and improve individual capacity. Within Public Health Ontario, there is an infection prevention control support team. So this team responds to requests for IPAC support, introduce and disseminate PHO resources and tools, as well as provide implementation on IPAC initiatives to achieve best practices, facilitate networking and collaboration. We do have different communities of practice within the different regions of Ontario, and informed IPAC-related researches. So as I've mentioned, I want to highlight a few of the resources from Public Health Ontario. I'll start with the online education and learning resources available. So I'm sure by now you're familiar with our PHO website. So this is the PHO landing page. As you scroll through the PHO landing page, you can get to the education and events section. This will expand to the online learning page and will take you to the infection prevention control specific online learning modules. There are different modules available as you get to that page, such as your infection prevention control for healthcare workers, IPAC for non-clinical staff. There's also modules for reprocessing in community healthcare setting, as well as CDI resources for case scenarios. Other webinars and resources available. This orientation roadmap for IPAC leads in long-term care, which was released last year together with a series of 6 webinars. And these are the checklist and the series of webinar presentation will help build your IPAC knowledge in your care setting. So these are all available within that online learning page. The most recent release that was posted on that page is with regards to the infection prevention control tips for visiting all healthcare settings. So there is a fact sheet as well as a pre-recorded presentation that you can share with your patients, residents, and visitors to your setting. And this provides basic infection prevention control information as well as visual aids that can hopefully assist with in gaining knowledge on infection control. Our COVID-19 page is regularly reviewed and updated and refreshed. So within the COVID-19 page, you will see a section on settings. So there are different settings with different resources that are available on each one of those settings. So if you're from a congregate living setting, there is a section there for you for long-term care, retirement home. If you're from a other healthcare setting, there's additional resources there for you as well. Once you click on your specific setting, it will take you to a host of different products, guidelines, documents, resources that will be valuable for you as it pertains to COVID-19. So you can check that and avail of those resources from PHO. One of the really a go-to document of evidence-based practice is the PIDAC documents, or the Provincial Infectious Diseases Advisory Committee Best Practice Guideline. PIDAC is an independent committee that is supported and coordinated by Public Health Ontario. It consists of multidisciplinary professionals with expertise and experience in infection prevention control, and they produce best practice documents and evidence base to improve the quality of care of patients as well as residents. To get to the PIDAC documents, again, you go to our website and you can find that within the health topics section, and then you get to the infection prevention control part. It will take you to the PIDAC, all the PIDAC documents. For today, I would like to focus your attention to the best practice guideline on environmental cleaning to prevent the spread of infection. The rest of the team will do a deeper dive on this best practices as they go over with you for the next presentation. But this is one of those best practice guidelines that you can use in your IPAC program, in your environmental services program, when you're developing policies, training materials, and protocols. Another important section on PHO where you can refer to on environmental cleaning resources is on the section environmental cleaning. There is an environmental cleaning toolkit that is available where you can find additional resources. There's also online modules there and video that will help you in training your environmental staff, as well as increasing your knowledge in infection prevention control. Additional helpful resources, not necessarily pertaining to environmental services, but just to point out to you, there are resources with regards to healthcare associated infections. So if you have questions about MRSA, VRE, Clostridium difficile, and other organism. You can also find this within the diseases and conditions sections of PHO. So there's many sections within PHO where you can find resources to build an infection prevention control program and environmental services program. As part of the environmental cleaning role, they have a role to play in the construction, renovation, maintenance, and design of facility or the organization. So there is good resources on CRMD pertaining to environmental cleaning. What you can see here is a checklist for environmental services, and it tells you who's responsible for what from the planning stages of construction to the work phase to the commissioning phase. So this is, again, a good resource for environmental cleaning that I just want to highlight for you that's available in PHO. So there are products that are coming soon with regards to environmental cleaning. So the plan is for this to be available the end of June towards July. So these are the resources available for you. So stay tuned for all this additional resources and updated resources from PHO. There will be communication that will be coming out to our stakeholders once all these materials and resources have been released. So that's all for me from PHO. So I'll turn it over to Kitty from Southwest IPAC Hub.
Hi, good morning, everyone. My name is Kitty Chan, and I'm from the Southwest IPAC Hub. Today, we're going to talk about environmental cleaning and disinfection and where to start. For today's agenda, we're going to go review what to look for in a cleaning and disinfection product, how to read a product label, followed by an interactive activity. Then we'll review your cleaning and disinfection program, discuss next steps, and finally a wrap up. There are many different products, cleaner and disinfectant, that are available on the market. It may be overwhelming when you're selecting a product for your facility. Some of the main criteria during selection is that it needs to be labeled as a disinfectant. If the product is labeled as a cleaner, it cannot be used as a disinfectant because it may not contain the active ingredient that are effective in killing the germs or pathogen. And always use a disinfectant with a drug identification number, DIN, or natural product number, NPN. These numbers mean that the product formulation, labeling, and instruction for use has been reviewed and approved by Health Canada. One thing to note is that household bleach may not have a DIN number, but if diluted properly and used at the right concentration, it can be a very effective disinfectant. When selecting a disinfectant, other criteria such as choosing a product with short contact time, for example, less than 5 minutes, may be preferable. Contact time is the amount of time a disinfectant needs to sit on a surface without being wiped away to do its job of eliminating germs. If you have a product that requires 10-minute contact time, it will likely dry out before the desired time is reached, or you may have to continuously apply the disinfectant to the surface to achieve the 10-minute contact time, which is not very practical. You also want to choose a disinfectant with a broad spectrum activity and effective against multiple pathogens. You can find this information on the product label or information sheet online. It is recommended that a product with effectiveness against norovirus be used because norovirus, we know it is very hardy and then resistant to many different types of disinfectant. So if you choose a product that is effective against norovirus, it will likely be effective for most other common pathogens. Every facility is different in their operation. It is important to thoroughly review the product and determine which disinfectant would work best for your facility. For example, you may have to trial a product to see if the disinfectant and the services are compatible. Some disinfectant may cause breakdown or discoloration of surfaces, which can be very costly for your facility to replace. Another consideration is whether the disinfectant is a concentrate or ready-to-use product. Ready-to-use may be more practical as there may not be a need for dilution. However, the product may be more expensive. Concentrate may be more economical, but staff will require education and training in diluting the product and using test strips to verify that the right concentration has been met. Ease of use is also important. Is the product a one-step cleaner or disinfectant or two-step product? Certain products are formulated with a disinfectant and a surfactant or detergent that are capable of cleaning and disinfecting in one step. This will be more practical in terms of contact time, staff time, and ease of use. If your facility chooses to use a product that requires two-step, then you would have to clean first with one product and then apply the second product, which is the disinfectant, for the required amount of contact time after cleaning. When choosing a product, you want to make sure it is safe for your staff and occupants. For example, if there are any residue left on the surfaces after use, or is there any sensitivity concerns. So having staff input may be essential when you're evaluating a product. It is important to review the product label thoroughly to determine whether it can be used within your facility, if it is practical and easy for staff to use and to follow instructions. If the product is not practical or if the instructions are not clear, staff will likely not use the product or use it incorrectly. And finally, whether the product meets the best practice criteria listed in the IPAC document. The best practice document for environmental cleaning is available on the PHO website, and it is a good resource to have in your facility. So now I'm going to pass it on to Diane for the interactive activity.
Thanks, Katie. I'm from the Guelph Wellington IPAC Hub, and I just wanted to say before we get into the activity that this is just a starting point, especially if you're wanting to switch products or you have a product that maybe you don't like and you want to move towards something different. It is just one part of environmental cleaning, and we plan to go into more complicated or detailed things that are found in the best practice at future sessions. So today is just more of that starting point. But please think about what sessions you'd like to have in the future, and we'll definitely put those together. Next slide, please. So now we're going to move towards completing activity together to reinforce the concepts we just learned from Kitty about product selection, because knowing whether the product meets that criteria is really essential in your work. And we're going to run through this activity virtually today on the screen, but you can take these ideas that we present today and work through this again on your own using the existing products you have or ones you're thinking about buying for the future. And if you don't have access to the label, especially for ones you're thinking about, you can go online and get that information, or you can contact your supplier directly and they will and should provide that to you. Okay, next slide. I also wanted to just flag that this is a sample label that we're going to use today for this activity. We did send this out in advance of the session because it is going to be a little difficult to read because the font is quite small. And you may want to zoom in on certain sections as we work through this sample label activity. And I just wanted to point out that it's a pretend label, and it's really just for learning purposes for today only. And public health units and IPAC hubs do not endorse specific products, and we don't recommend specific products. We only advise based on the criteria we covered today and the active ingredients, but never a brand name. Okay, let's get into it. So next slide. Okay.
Diane, just before you get into the activity, I do see a hand up from Tam.
Oh, sure. Go ahead.
I don't know if you can come off mute, Tam, and ask your question.
Yes. I'm not very sure because, you know, sometimes I have the question right away, and if I wait until the end, I may forget. So sorry about that. My question is, you know, we contract our services to a cleaning company.
Okay.
And because you mentioned a very good thing that, you know, I assume the contract company, they know how to use those, or, you know, should we say, okay, hi guys, this is the product you need to use according to the guideline from the public health. Yes, please, thank you.
Yeah. No, I think that that's a great question. And it's definitely something, if you contract out your environmental cleaning, it's something to have a discussion with them about. You could review that criteria that you'll get through the slide deck and then work through with the products you know that they do or don't use. You could ask them to provide that information and you could compare it and you could work through this label activity yourself based on what they provide with the products they're using. So I would start with asking what products they're using, and then you can figure out the rest as we go through this. But I definitely think that this would fall into that category as well. Okay, so if you could just advance the slide, you'll see a whole list of items that are going to come up forward. These are the kinds of things that we want you to look for when you're reviewing a label. These are the really important and key pieces of information that you'll want to know if you contract out your cleaning, but that you'll want to know for the products that you use in-house, and that you'll want to know for products you're considering buying in the future. This is what public health and IPAC clubs will want to gather that information in order to best support you and best provide help for you. So you can take the label out if you have that handy, and we'll move to the next slide, and we're going to start looking on our label for that. So we'll get right into it. Okay, so first we're going to look at the middle portion of this label, and we can see some of the key identifiers here that we had on our list. It tells us the name of the product and the DIN, or that drug identification number. You can use that DIN to search on Health Canada drug product database to learn more about your particular product and how to actually use it, because not all products are the same. And we're going to have a link at the very end of the presentation so that you can search that, or you can just search Health Canada drug product database and pop that number in, and it will provide you with lots of really valuable information. So really important to find that, and that it has that, or that natural product number. It also tells us on the main part of the label that it's a one-step product, and it mentions the word disinfectant cleaner. So this means that you would pre-clean still and remove all the visible dirt, or the dirt that you can see first, and then you would apply the product just once to clean and disinfect together, but making sure you follow that contact time on the label. If you did happen to have a two-step product, you would still pre-clean, but then you would clean and then you would disinfect, which takes longer. You have those 3 steps versus the 2, the pre-clean and the cleaning and disinfection together. And that's something that if you are using something like bleach and water, that you would have to do, and it does take a little bit more time. So it's something to think about for sure. It also happens to mention that it's a concentrated product. So for this particular product, you would need to mix it with water to figure out a way to do that consistently. That's the most important thing, is the consistency, so that it's working the way that you need it to, and the way that it's intended to. Because if you over or under mix a product, there's lots of problems that can happen either way. And things like automated dispensers and test strips are really valuable tools that you can look into and purchase from your suppliers or on your own separately, that will really help your staff stay consistent when they're mixing things from concentrates. Another item.
Diane, I'm sorry to cut you off there. I think you're cutting off on and on for me. I think there's somebody saying too that you're hard to hear and freezing. So I don't know if there's something you can do.
I'm so sorry. My internet connection is stable. My mic is on and working. Can you hear me right now?
Yeah, I can hear you right now. Maybe
Okay.
just
if
getting
I
closer.
Again, just let me know, okay? I'll try to move closer to my mic. But if it cuts out again, please just let me know. I'm sorry. Okay, I'm gonna move closer. Sorry, you'll just see my face close to my my camera. Okay. Okay. So another item that you can see from our list that we have is around active ingredients. So you can see on our label here, it's listed there. Our active ingredient is killing juice in our label. And based on where you're using the product and which organism you're trying to inactivate, some products are better than others. So for example, products that are listed as quaternary ammonium or quat-based products, they have a much longer contact time, like 10 minutes, and they're not effective against viruses like norovirus, which you want to have coverage for. And you will know what type of product you have by looking at the label and looking for that active ingredient. So if you did have a quat-based product, we would likely recommend that you switch to an alternative because you wouldn't have coverage against something like norovirus. So we're thinking of other things other than just COVID as well. Okay, next slide. On this section of the label, you can find more key items that we need to review the product label. It tells you the next really important thing around contact time. And that means it's when the product must stay wet on the surface to inactivate the germs that the label tells you it's effective against. So the shorter the contact time, the better, as a lot of products, they dry up really quickly before you get to that time. So 1 to 2 minutes is really ideal, but anything less than 5 is okay. If you have something more than 5, then you'll likely need to switch your products. But the important thing to remember is even with a really short contact time, it's important to know that the staff may still have to reapply that product so it stays wet for the time, whatever time that is. So on our label, you can see that our contact time is 7 minutes. So we're going to flag that and likely want to switch that product to something that's shorter. Make sure when you read the label, you see if there's more than one place where contact time is listed, which may be really tricky to interpret as well. Sometimes products have more than one listed. So one would have a contact time for, say, for sanitizing, and then a contact time for disinfection. And it's really important to look for the contact time where it says disinfection and not sanitizing, because sanitizing is something that we look at in the kitchen or on food surfaces only, and it's not applicable for the rest of your setting. It also mentions here how to dilute the product, so like how much water and how much product you need. So make sure it's really clear to your staff when they are mixing from concentrate, which is which, so that they don't invert that relationship, which can lead to things like chemical burns. You can also see below, it tells you how to clean up after blood and body fluid spills. And it mentions here that staff would use the same dilution for this particular product as before, like for the regular mixture, but oftentimes just to flag that this will change and it's not usually the same. You usually end up using a stronger mixture when it's a blood and body fluid spill. And I also wanted to point out that this particular product, as you can see, has 3 separate steps for a spill cleanup in order to use this product as it's intended. So a pre-clean, then a clean, even though it's marked as a 1-step product, then a disinfection step. And this may not be practical for staff to always follow. So if you had a product like this, the first step you would do would be to check with your team to see if that process is actually working for them. And if not, look into other products that maybe have fewer steps or a shorter contact time, because it's really important to save staff time. And you can also see here it lists the PPE requirements, which is another thing we wanted to look for. It requires PPE as appropriate when cleaning up blood and body fluid spills, but doesn't mention the need when mixing or using it for routine cleaning and disinfection. So you could choose your PPE based on your point of care risk assessment. And some staff may still prefer to wear gloves if that product is really harsh on their skin, and that's okay. But if they choose to still wear gloves, it's really important to still review glove use with them and make sure they're removing their gloves after each task and not universally wearing them, because that's the problem, because that's when it can lead to cross-contamination. Okay, next slide. We're on our last section of the label. The last 2 items you can find highlighted here are the shelf life and the expiration date. Shelf life is really important for products that are mixed from concentrate, but not for ready-to-use products. And this tells you how long it can be used before it has to be dumped and then redispensed. Some products can last for up to 30 days and some only just for 1. So it's really important to review, because you may want to find something different based on the time your staff have, because that takes time to keep mixing it. And if it's not on the label, you can still request this directly from your supplier, and it's really important that you try to get that information for your product. It's always important to remember too that products should never be used past their expiration date, even if you're using test strips and even if the test strips still say that it's okay. And you need to know how to read the date on your label as well, because sometimes it can be tricky. It's marked as year, month, day, or day, month, year, and it's not always clear which is which. So getting that clarification is important. And other times, some products are marked with more complicated expiration dates with a Julian dating system. So just be sure you understand what the date is and what it means. Because if you want to also make sure when you're sourcing your products, you're sourcing it with a far out expiration date, so you don't run the risk of having too much product or expired product that you have to throw out and you still have enough. So it's a fine balance. Okay, next slide. The last few slides, we're going to go through a few steps now that we've reviewed how to select the product and how to read the labels. Now we're going to talk about doing an inventory of your process on where to start now that we know, say, the product that we're using, and reviewing your current process. So first thing we want you to do is to do an inventory of all the current products that you have. So where they are, how much you have, that kind of thing. You may only have 1 or 2 products in use, but when you go looking, you may find a few other random bottles here or there that shouldn't really be there at all. So in order to help you work through this inventory, we have a sample Word template as well as an Excel template that we're going to share out with our slide deck at the end of the presentation that you guys can use. They're both editable. You can use either one or the other. They're both essentially the same. Some people might prefer to just print the Word version off versus using an Excel spreadsheet. And the Excel spreadsheet does have a tab for using a ready-to-use product or a concentrated product. So you can fill in whichever one's easier for you. So we're going to kind of inventory what we have, where we have it. And then once we know all of that information, we want to know what the staff are using and then how they're using it. And you can do that. You would start by doing those observational audits. So just watching them do their work to see how they're like what process they're actually following and if it's in place, and whether those key pieces that we know to be true on the label, whether they're actually translating in real time with your team. Everybody wants to do the right thing. It's just a matter of there's a reason why maybe sometimes they're not doing those pieces, and knowing what they're doing in real time and then trying to figure out why it's not matching is really important to know. You can also do things when you're reviewing the process by looking, if you use wipes in your facility, you can go around and sort of see things like, are they actually using the wipes? Are the wipes canister lids closed, or is it drying out and we have to throw out a lot of products? So kind of knowing what they're doing and how they're doing it's really important, so we don't waste product and we're doing things effectively. And just going back to the wipes too, you could also just want to make sure if they're in the right place and where the staff need it to be. And you can do something simple like just dating the bottom of your wipe canisters with a date that you go around to do your audit, and then going around in a future date and checking to see whether they're using that, where the product is, and it'll tell you whether you need to rethink the placement of that. Because if they're still full, that means nobody's using it. So this inventory process is going to help you decide what needs to change and what you need to prioritize. And just to flag, Brian's going to go through this in a little bit, but the hubs can help you figure this out. If this is all too much and you need help working through this, we can definitely help you with that. Okay, next slide. So now we're going to take action. This is just a screenshot of part of the Excel spreadsheet, but both logs have a place to mark where you want to take your action. So the hubs can also help you with this. If you don't know what to do or how to do it, but you know you need help with that, you can definitely reach out. And these are just a few examples of what you can put when you want to take action. So you could write something like mark bottles with shelf life if the staff are not replacing the bottles often enough. You could write train staff how to use the test strips if you notice they're not using them or they don't know what to do, or if it's being dispensed at the wrong concentration. If you notice a lot of your products are expired, then you may need to look at streamlining your products, or a few products, get fewer products, ordering less often if you're not going through it as fast as you were previously, now that things have changed slightly. You could also make a note to recalibrate your dispenser if you notice the wrong concentrates being mixed or it's not really consistent. And you may want to replace and remove your expired products. But if you're not sure how to do this safely or where to actually properly discard your products, you can just start by flagging them or moving them to another spot where staff don't access that day to day or use them by mistake. Next slide. This is just a screenshot of that sample Word template that we're going to send out as well. You can definitely edit it, customize it, do whatever you want. This is just our suggestion as a place of where to start, but it's definitely customizable. Next slide. Okay, so these are just a few final considerations when reviewing your process for environmental cleaning and disinfection that you can think about after today's session based on what we talked about as a whole today. So streamlining your products and using the criteria we discussed to source a product that works for you, and reinforcing key things like contact time and how to use the product are really essential. Next slide. So we've gone through lots of information. It can feel a little bit overwhelming, especially if you're newer to this role, which I'm not sure if everybody's level of experience, but it can be a lot to try to follow up on the process. And in a minute, Brian's going to walk through how hubs can help you with all of this. But this is just a summary of the main ideas we talked about today that you could work through with your existing products or new products, or if you hire out your cleaning, you can work through this process with your the company that you use to clean. But first you just collect all the information that we talked about, and then you review it to make sure it meets your needs and works for your team. Then you understand how to use it and you build your process around that. And finally, you take all this information and you train your team so that they can work towards being more consistent with following the information on the label to minimize spread. Okay, so with that, I'm going to hand it off to Brian, and Brian's going to go through how we can translate the PIDAC documents and everything we've talked about, and how we can move to having the hubs help you and that direct support.
So Diane, I think there is a question in the chat just before we move to Brian. The question that is being asked is if you could repeat where we can find information about product and first aid with the DIN number. So okay, I'm wondering if you can go back and review that piece.
Yeah,
do you want me to go to back to the slide, Diane, or?
No, that's okay.
That's okay. Okay.
See on this slide, the main piece we wanted to reinforce was you're looking on the label for the drug identification number, or the DIN, or it may have an NPN or natural product number like Kitty had suggested. And you're going to go to the website called Drug Product Database, or Health Canada Drug Product Database, and we'll have a link at the end of the slides with some resources. And you're going to search by the name of the product, like brand name, or the DIN, which is easier to just pop the DIN in, and it will give you information about how to use the product. If you want specific health and safety information, you're going to look for the safety data sheet, or the SDS. And the suppliers will and must provide those to you, and they are all available online, so you can gather that information as well and have that handy for your occupational health and safety needs and your WMIS requirements.
So one additional quick question, and then we'll go over to Brian. The last question is, I've just switched to the Quat 3 Pro plus fill disinfectant. Are you saying that this should be switched as ID does not cover the norovirus?
I would, before you make any decisions, because you've just switched, so that's something that might be a very quick decision to make. In general, Quats and quaternary ammonium products don't have coverage for norovirus. This may be a different formulation. We're not always familiar with all the latest and greatest and newest products, but from my experience, all the quat-based products that I have seen do not have coverage for norovirus, but that being said, there may be some newer products and formulations on the market. So your first step I would take is to pull up the label on your product, and it will list what is or is not effective against. You'll be able to see that clearly. So it'll tell you what it is effective against on the label. And if you still need more information, you would search the name of your product and with the words product information sheet, or contact your supplier directly and just ask them, does this product have coverage for norovirus, and what is the contact time? And then they should provide that back to you in writing, and I would just have that documentation handy. It may be effective against norovirus. I would just do that legwork and gather that information first. And then once you have that, if you can see that it doesn't have coverage for norovirus, we would always recommend that you have one that does.
Thanks, Diane. Just to sort of add to that component, so a lot of the disinfectants will have various different kill claims that they've been tested against on the label, which Diane mentioned. Depending on the manufacturer, some do not put all the kill claims on the bottle, and they may have additional information on the product spec sheet. So some of the companies out there are very good about putting together a complete write-up about their product and what it's effective against. So it may not be on the label, but you can kind of look into it a bit further just to verify. And as Diane mentioned, as a last step, you can always reach out directly to the company to seek some of their input there. So thanks Diane, just for covering that particular section. And I'm going to take us through a little bit about how we can use the different information and resources to bring back to our facility and look at kind of the current products and processes we have in place, but also how the IPAC hubs are structured to sort of support this type of practice and undertaking. because I know it can be overwhelming in some cases, and we're definitely open to assisting further as needed here. So we talked a lot about inventory and looking through our current products. And many of us can attest, especially over the COVID pandemic and some of the supply chain issues that came out of things at the very beginning. Cleaning and disinfection products was one of those areas where we had some challenges with the supply chains. And I know many facilities, just to make sure they had adequate supply on hand, ended up purchasing multiple different types of products just to make sure they had adequate supply. So this is really a great time now that the supply chains have really kind of come back around and everyone's in a much better position to really take a close look at what products we currently have on site, and making sure they're most appropriate for our day-to-day needs and uses. So really, and I've seen this many times, that sometimes we end up with all kinds of different products that are not necessarily being used anymore, but they're still accessible and they still may be used periodically by different staff. So really taking some time looking through and going through that inventory is a great first step. And just identifying what we currently have in place. I know some facilities may have multiple different locations, and each location may have different products in use at that particular site. So it's a great kind of practice is going through and doing that inventory practice just to see what we have out there. So once we have a general idea of what the current practice or what the current products we have available at the different locations or at your specific location, really taking some time to review the processes that are being used on site. Do we have, specific products for different activities? Is everyone kind of using the same sort of procedures or products? One thing that often comes up, and I know wipes was mentioned there, sometimes wipes get overextended and we're trying to utilize them for larger surfaces. And that can certainly come back to not being able to meet that dedicated contact time. So sometimes it may be beneficial to have both a liquid disinfectant and also a wipe product on hand to really look at different surfaces and different practices when it comes to cleaning and disinfection on site. One thing we can also do as part of this process in reviewing our process here is really speak with staff, try to really get some of their feedback. Is this working well for them? Are they able to easily meet that contact time, or is this delaying some of their process where they're having to go back and re-wipe a surface again? So really trying to get some of that feedback, making sure that we have a good idea of how the different products are being used at our locations, and then really taking this information back. So once we have a good idea, we've gone through our inventory, we've done a little bit of auditing to see kind of how things are being used, if they're being used appropriately, and coming up with ideas that we can kind of address maybe some of the gaps that have been identified. Maybe there aren't many gaps with your facility and you're doing a great job, but it's still a good idea to go through this process. Or perhaps there's quite a few things that come up as part of it that need to be targeted for future improvement. So there's various different ways and resources where we can address these gaps. That could be things such as putting together training sessions on product use or application, looking at our processes in general. One thing that's very helpful is to have a consistent sort of standardized process for how and what products we're going to use for different practices on site. That way, if there's consistency, whether it's between different locations as part of an agency or just between different staff, so we know how the products are being used, we know what's available and out there for each kind of task that we're being tasked with. And then from there, looking into different checklists and tools that may be able to help reinforce some of those key messages. Next slide, please. So just some take-home messages that we have to leave you with today. As we saw in going through that exercise with Diane, our products labels contain vital information to assure appropriate and safe use of chemical disinfectants. It really helps to have a good, solid knowledge of the different products that you're going to be using day to day. Streamlining the different products that we have available will really help make sure that we're very knowledgeable in each and every one. We know how they need to be used appropriately to make sure they're effective for what we're looking to do with them. Know how and what to look for in a product. So if you're currently shopping around to see if there may be different things to suit your needs better, what are some things we want to look for? As was mentioned quite a few times today, contact time is one of those things that you should certainly be taking into consideration to make sure it's practical, it's going to work well, but also that the product is designed to make sure we're taking care of the different pathogens we may come across in our day-to-day practice. Periodic review of our products and practicing product rotation can certainly help reduce waste and ensure adequate stock on hand. So drawing from a food safety example, one of the ways we can do this is using the FIFO method. So first in, first out. As we get new stock in, we push it towards the back of the shelf, and we're always pushing that older product forward to make sure it gets used and we're not having to discard any products as we come across them and they're past their expiry date. So I know when we're reviewing products and you're speaking with your sales rep, this can sometimes be a little bit daunting. So we're certainly there and available from the IPAC hubs to provide further assistance in this category. So if we just jump to the next slide, we have a few different ways that we can potentially help when it comes to your cleaning and disinfection program. So some of the ways that we can do this could be something like an on-site visit just to review what current policies and how you're applying these different products on site. So an on-site review and sort of auditing of the current processes that are taking place. We can definitely help and provide assistance with reviewing what you do have available, whether or not it may be effective or appropriate for the different types of uses. But also we're providing some of that best practice guidance and recommendations. So especially when we're dealing with some of those harder or challenging to kill organisms out there. So we've got a couple examples here. Norovirus has been mentioned. That's certainly one of the common ones that we may come across, and the activity has picked up a little bit as of late. C. difficile is another good example as a spore former. It's one of the more challenging ones to remove from our environment. So if you need some assistance or some further guidance when, whether you're faced with a situation of this would be a great time to reach out to your local hub for some of this information. And also when it comes to feedback on providing recommendations and guidance around new purchases. So as Diane mentioned, we can't direct you to one specific product, but if you're able to bring a product forward to us, we can do a little bit of background digging to see and provide some of those pros and cons for each product to see if it may be effective for you and appropriate for use in your facility. So many different ways that we can kind of provide some of that extra support, and we'd really love to hear from you if you have some needs in this area as things kind of move forward here. So I think there was a question about local hub contacts. So this is kind of perfect timing here. So on the screen here, you're seeing some of the contact and intake emails available for the different hubs across the West region. We also on this slide here, which is going to be shared out towards the end, we have the intake line for IPAC support from Public Health Ontario, as well as Michelle's contact as our OH West IPAC representative. Next slide, please. So as was mentioned by Michelle towards the beginning of things, we do have a couple poll questions, and we would really appreciate your input in terms of what you may be looking for in future webinars and community of practice type events. So if you can take a minute just to fill out the poll that we have here, it would be greatly appreciated.
I'll maybe just mention to make sure you scroll through the poll, because both questions are together in the poll. So you just have to scroll through to get to both. And I'm not sure if maybe there's a few other questions in the chat maybe we can talk about while people are doing the poll. I think there was one question about They're kind of related. It just is around, is there a company that will come out to your home and walk through the housekeeping procedures and make suggestions on how to better clean the home, and not to inspect, but to advise? So this is the role of the hubs. So the role of the hubs is not in an inspection capacity. That's the public health units. The hubs role is they may come and do a supportive visit that may include looking at things, but it's not an official inspection. It's what you had suggested around walking through things and advising on things to review what's happening and how it's happening. So the IPAC hubs are the right fit for that. And you would reach out through those contact emails that you have to get to your local IPAC hub and connect with us directly. And then we can make plans to come on site and start together and do a little consult, and then come on site and have a review of your process and figure out where to help you prioritize things. And then the other question was about recommendations if they don't use a commercial like product or a household cleaner, sorry, instead of a commercial product using a household cleaner. So Brian, I don't know if you want to take this one to answer.
Yeah, so we could still sort of go through the same process in terms of what to look for on the label. So just because it may not be a commercial product, there is certainly differences out there on more of the residential products. So certainly looking through contact time, looking to see what agents or what pathogens that may be effective against. But one of the things I would caution here, and this is what tends to happen with smaller settings, you really would want to promote a consistent product across sort of the agency. So you don't want to have that situation where each time you're going out to get a new product, you're getting something new, because that's really going to lead to having to go through that education component again to make sure it's being used properly on site. So trying to find something consistent, and that's where there may be some benefit towards looking towards more of that commercial product where you can order in a little bit larger quantity and distribute to your different settings across your agency in this case. So it's not to say you can't get something that's non-commercial, but you do need to be kind of thoughtful in what you're looking through and looking through that label to make sure it's going to address your needs, and you're going to be able to consistently use and apply that specific product there. So I don't know if there's any more questions, but we're going to end the first one here, and if we can bring up this second poll.
I think the polls were together. They were one, and then the other was right behind it. Yeah. There is a couple other questions here. I just see the last one maybe, and then I'll kind of work backwards and we can maybe go back and forth, Brian.
So I see the one in there. So are you able to advise on the safety effectiveness of portable electrostatic sprayers to disinfect surfaces, for example, patient rooms? So this is one of the newer technologies that we've seen come out towards the beginning of the pandemic. It is very important when you're looking towards something that's like an electrostatic sprayer to follow the manufacturer's directions. So what I can say when it comes to these products, they have very specific health and safety parameters that need to be followed. Oftentimes the room needs to be vacant for a certain designated amount of time, because what can happen with these is that it's putting it into the air. So certainly something we don't want to come across from an occupational health concern, that you don't want to be breathing this in. So it's very important to follow some of those safety precautionary statements that come with them. But they can be effective. The idea behind it is that when you're spraying in an electrostatic sprayer, it's supposed to cling on to the surface and provide a little bit better coverage. So again, it's really one of those things that looking and reading through those instructions, and anyone that's going to be using an electrostatic sprayer should be provided with dedicated training for that equipment and device.
There's also a question in here about whether we would recommend pour or spray caps. So PIDAC, it does say within the PIDAC documents that spray bottles are not recommended. So I would encourage you to switch to a wipe format or to a pour format or a bucket system that doesn't result in cross-contamination. There's also another question in there about a map that does show the boundaries of all the IPAC hubs. And at this time, there isn't one per se, but when you get the resource list there is no wrong way to approach. If you contacted the wrong hub by accident, that's okay. We will redirect you to where you need to go. You definitely don't need to worry about that. So there is no wrong door to follow, and we connect with each other. So we will definitely connect you with who you need to connect with based on the city that you're in. And then there was another question around the backgrounds around the people that are within the IPAC hubs, and it's varied depending. Some IPAC hubs are within public health units and some IPAC hubs are within hospitals. And everybody has that infection control background, and they could be, say, a public health nurse, they could be a public health inspector, they can be an infection control practitioner, but we all have background in infection control, and these sites were selected based on that IPAC expertise that we do have. Okay.
I think that's most of it. Oh, there's one about odor control.
Yes, and then Rodera followed up around the new technology. She just wanted to reinforce everything you said, Brian, and then reinforce that if you are using that electrostatic spray unit, that you would still need to mechanically clean with that friction. You can't just use that as a one-stop shop. So that's good. And then there was an odor control question from Different Oaks, and so we can definitely talk about that further offline if you want, because they're sort of within our health unit jurisdiction. But really, odor control is sort of a separate issue related to that environmental cleaning and disinfection piece. If you were basically wanting to have something, you've done your cleaning and disinfection, and you need to look at just odor control, that's the first step I would think is you'd want to contact your supplier and ask them sort of what their options are. Our wheelhouse is really more around that environmental cleaning and disinfection piece, and not per se that odor control. But I don't know, Brian, if you have anything you want to add to that.
No, that's pretty much in line with what I was going to say too. So
okay.
I know we have a couple more slides to get back to if there's no more questions. If we can just quickly put that up, and we can wrap things up for today.
Sorry, I have a question. Would it be safe if I share after I receive the presentation that you are going to share with us? Would it be safe to share this information to the cleaning company that they do the cleaning for us, and then to ask them, this is information from the public health, and then are you compliant with this procedure, those kind of things. I just want to make sure, because I contract with them, but I am not the expert. Okay, yeah, and when we do with them, they say, oh yeah, we do this kind of thing, but in terms of auditing, honestly with you, I have to be like we thought they know what to do, and then they know how to use the product because they are the specialized in the cleaning, right? Yeah, that's my question.
I would say that's a really excellent question, and I would say if you want, the IPAC hubs helps with that. I would say they may not know all of the detailed answers, which may be something you have to work over time with them to collect. And so I would just say, as a first step, again, figure out which products they're using. And then you could connect with the IPAC hub if you need help interpreting that label, and whether that product at first is even a good product option. If you don't want to do that independently, which is okay, the hubs can help you with that. And then once you know if that product is okay, then we would work with you to help build your capacity, so you would be able to understand sort of how they're using it and whether that's okay or not. But we would say, just based on your area, you just reach out to your local IPAC hub, and we can help you walk through that separately, okay?
Yeah, thank you very much. Yeah.
So just to end things off for today, we do have a number of resources that may help you provide some additional details for your cleaning and disinfection program here. So again, the presentation will be shared following, so you don't have to scribble these down quickly or anything like that. One of the sites that Diane mentioned, so the drug product database is included here. So you can search for the product that you're currently using to see if it has an appropriate DIN, as was mentioned. There is also the Health Canada hard surface disinfectant database that came out specific to COVID, really. But there's also some other great products here and resources to review. So the PIDAC best practices document for environmental cleaning, it is a very large document, and we don't expect anyone to know from beginning to end by any means, but it's a great resource if you're looking for specific information. Say you're looking for information regarding norovirus, they have a specific section on norovirus within this document. It references what types of products would be best recommended to address it. Or if you're looking for information for a blood spill kind of cleaning policy, there's a sample blood spill policy in there. So it's a great document. But again, it's very large. It's a little bit daunting when you first look at it, but it's a great kind of resource where you can kind of look for those answers for questions that you're trying to answer. So if we just jump to the next one, I think we have some more there. Again, the environmental cleaning toolkit is available on the Public Health Ontario website, and there's going to be some additional resources coming in the near future, as Rodora had mentioned. But there's also some other great resources here. So have a look if there's anything here that may be of interest, depending on the setting that you're coming from. And just to close things out, we appreciate everyone attending today. We're going to take some of those poll answers back and kind of consider some future topics. And as Diane mentioned, this is really just scratching the surface when it comes to environmental cleaning and disinfection. There's a lot more sort of details that we can get into, but we really wanted to start with something basic and sort of work up from there. So thank you, everyone, and I hope you have a great rest of your day.